Hello, my name is Angeline Thomas, and I am one of the co-chairs for the Birth Equity Committee at Alta Medical Center, and I'm also currently the vice president of the medical staff. At this point, it's well known that Black women have worse perinatal outcomes giving birth, including maternal mortality. So a lot of women come into my practice armed with this information, African American women, and they look at me and say, I'm scared, and how can I not be a statistic? So I spend the first part of that conversation just listening to them, what their concerns are. And then I tell them that I am the co-chair for the Birth Equity Committee, that we actually have such a committee at Alta Bates Medical Center, that we have processes in place and quality initiatives in place to decrease the probability of them having a poor maternal outcome. I tell her that we value her family, we value her baby, and then just hearing that from most women, that's enough just to make them feel comfortable. And I have many patients that come to Sutter facilities because they feel like Sutter really values equity work, and they feel like they would have a better, more safe, equitable, caring, patient-centered experience at our facility. Last year during Juneteenth, we gave flowers to all Black birthing persons during that week. We gave them a card that has an explanation on Juneteenth and gave them some appreciation and sense of gratitude for how we welcome them to our facility. And then we also gave them flowers. So on the first day, I went to the room of a patient, and before I got into her room, her nurse, who was also African American, said, "Don't go in there, she's having a hard day." She had a difficult birthing experience, her baby was having some difficulties, and she pretty much said that she didn't want to be bothered. I felt that I needed to come in and give these flowers to her, so I said, let's see how this goes. So I knocked on the door, I walked in, I introduced myself, I congratulated her on her birth, I thanked her for choosing our hospital for bringing her child into the world, and I gave her the flowers and the card. And initially she looked at me and she was surprised, and then the look of surprise gave way to a smile. Well, I think giving the flowers, especially for this particular patient on this particular day, she clearly had a difficult birthing experience. She was having a difficult moment in the time that I walked in to see her. But giving her flowers, showing that we look at her as a person and we value her as a person, not just a patient, went a long way. I can tell that it softened her rapport with the healthcare team and that she felt more comfortable. And it actually made me feel great. That's why I went into medicine. I think that's why a lot of people go into medicine, because we really value humanity and we really want to connect with our patients in that way.